Professor Didier Pittet from the Geneva University Hospitals. If you read about him, you will be amazed because he is a very simple, humble person that I've had the pleasure of meeting over a year ago, thanks to Frank Schneider, who is also here. And I have to tell you that he is a CBE. Do you know what CBE is? Commander of the British Empire. So I could, if we were in England and if he were British, I would be saying sir or lord or something like this. But he's not, and we're not, and I'm just going to ask him to tell you his story.
Thank you. If you can have the first video. Thank you, Denise, and thank you for having us. I guess you probably got most of the message in this video, but let me give you a few more words of introduction. If I can have my slide, please. Welcome to the hospital. Infections are waiting for you at the entrance door of the hospital and will unfortunately complicate your hospital stay. But what is the risk? What are we talking about? What is the burden of disease? Let me tell you that every day, at least 500,000 patients in the world are getting hospital infections. Only in hospitals. We are not taking it because we have no statistics about infections acquired in private practice, in long-term care facilities, and so on and so on. The disease burden is huge. Every year, as many as 16 million patients die of healthcare-associated infections in the world. In the United States only, we are talking about at least 200,000 patients dying from healthcare-associated infections every year. The equivalent of a 747 airliner crashing every day or a death every 3 minutes. Nobody speaks about it, right? This is why I like to speak about the silent pandemic. The disease is the second largest cause of death in our countries. It is the first largest cause of death in the developing world. And importantly, no hospital, no country, no health system in the world can claim to have solved the problem. Well, by chance, there is a cure, and this cure is hand hygiene. Hand washing, we used to call it. Unfortunately, healthcare workers have problems to recognize how and when to clean their hands. And in 1994, at the University of Geneva, we asked ourselves, why is it that it is so difficult for healthcare workers to clean their hands at the appropriate time? So together with my nurses in infection control, we went to all the wards of our large hospital, day, night, 7 days a week, 24 hours a day during 3 weeks to monitor hand hygiene practices. And guess what? Nurses and doctors had just no time to clean their hands at the right appropriate time. Why? Because we were asking them to wash their hands with soap and water. Time to do it was too long. Time to go to the sink, turn on the water, apply the soap, rinse your hands, dry your hands, come back to your patient was too long. A nurse would have to spend at least half an hour of patient care every hour of care just to wash her hands. This was not possible. This was not compatible with the guidelines at the time. So we needed a product. We needed something that could ask fast, could be well tolerated for hands, and could be made available at the point of care everywhere care was provided. And to make a long story short, this solution is alcohol in the form of an alcohol-based hand rub that you make available at the point of care. And you all know about it, right? Because nowadays, you know that in hospitals we rub our hands with alcohol, and that hand washing is not used or almost not used anymore. It replaces actually hand washes with soap and water. So that's probably the end of the story, right? I have the solution, that's great. I give it to everybody at the hospital, and I hope for people to comply. Do you think it will work? Tell me. No. Why? Because in order to change behavior, you need something else. But let's take a daily common problem that I like to give you. That is your daily life. Is the fact that your car is equipped with a seat belt making you fasten your seat belt systematically? Be honest. The answer is no. What do you need for that? Of course, you need a seat belt in your car. You need what we call system change. Then what you need is actually rules and regulation, campaign to promote the use of seat belts. You need police controls. And for some of us, you need police tickets, right? This is what you call a behavioral change strategy that is based on a multimodal system. This is what we did. We used the alcohol-based hand rub everywhere in the hospital. We made it available very easily to everyone, right? We used the walls of the hospital to hang posters so that people could be reminded about the importance of healthcare infections. We actually monitor the performance and feedback the performance to healthcare workers so that they know where they are. And guess what happened? In 3 years, we reduced healthcare-associated infection by 50%, saving hundreds of lives in our hospital and large amount of money, the equivalent of 20 million euros per year to our university hospital. Now, clean hands save lives. In 2000, we published our paper in The Lancet. In 2002, the UK the United Kingdom converted to the so-called Geneva model of hand hygiene promotion. In 2005, the World Health Organization asked us whether we could imagine to generalize this campaign worldwide. And of course, this is what we did today. The campaign is active in 179 among the 194 United Nations member states, saving lives everywhere around the world, from very modern healthcare settings to settings with very limited resources in a very multicultural environment. But of course, this did not happen from one day to another. Addressing the issue of multicultural was not easy. You all know that in the Quran, Muslims cannot drink alcohol, right? I knew about it too. What I didn't know is that it may cause some difficulties for healthcare workers, Muslim healthcare workers, to apply alcohol on their hands. So we had to see that. We had to understand that. We had a story about a Muslim healthcare workers working in the UK, living at her father's place, a young female nurse. When the father knew that she was using alcohol on her hands every day in a hospital for the past 6 months, he evicted her from home, right? So then we thought it would be a danger to the spread of the campaign worldwide. So what we did, we went to Saudi Arabia. We worked with the Muslim clergy, with Muslim scholars. We got a fatwa. We went to the Muslim League, and this fatwa was accepted by the Muslim League. And today, alcohol is widely used in the Muslim healthcare worker population. As you can see here, for those interested, it has been published again in The Lancet in 2006. So this was one of the examples of a difficulty to change behavior because of culture. The next difficulty was to make sure that we could ensure universal system change. But when we say universal, we mean universal, right? So we need to make sure alcohol hand rub would be available at every point of care, everywhere in the world, wherever care is provided. And something should be affordable. And it was not affordable for everyone to get one of these very simple alcohol-based hand rub bottles. So what we did, we gave the formulation to the World Health Organization, we transformed it, we gave the recipe together with the formulation so that people could do it on their own at very low cost. And here is my friend Lozemi Bengali in his very modest hospital pharmacy in Mali. As you can see, very modest, preparing alcohol-based hand rub out of sugar cane. You take the sugar cane, you cut the sugar cane, you squeeze to get the sugar on one side, and with the leftover products, you can produce alcohol-based hand rub. And this is today called WHO alcohol-based hand rub formulation. You can make it of walnut, of potatoes, of sugar, of course, and many other, of manioc, and it's at low cost, and you can use it. It's absolutely safe. Today, it has been voted as one of the essential medicines compound by the World Health Organization. But this is not enough. We needed to let everybody to understand what is actually the importance of hand hygiene. So we got the privilege to have a French writer, which is the best scientific writer that can vulgarize stories, Thierry Crouzet, who wrote a book, Clean Hands Save Lives, about the campaign. He wrote the book, worked for 2.5 years for free, developing this book. And after he came to me and said, Didier, I'm giving the book. I say, it's a joke. No, it's not a joke. I'm giving the book. I want everybody to know about it. This book is freely available. It's available also on the Amazon, on the internet, and everywhere. The idea is that Thierry developed the book in the spirit of the economy of peace. And it worked very, very well because he told me, you have worked in the spirit of the economy of peace. So on the 5th of May of last year, the 5th of May is the day that WHO has chosen for a World Hand Hygiene Day in hospitals all over the world. The book was translated in 6 languages according to the spirit of the economy of peace, which means that the translators didn't get any money for the translation of the book. Today, the book is available in more than 12 languages in the spirit of the economy of peace, in order for patients to understand, their families to understand, and so on and so on. As a nice example, this is the social security system in Mexico. We are covering for 55 million population in this case. They have more than 350 hospitals. And in these hospitals, when patients are coming to the hospital and waiting to be seeking care, like pregnant women sitting, waiting to be seen, junior people coming for flu, and so on, these patients get taught by social health care workers how to clean their hands with a local produced alcohol-based hand rub solution to actually save lives. So as you can see, we promoted this campaign very largely. What about social media saving lives? You have seen this movie where we engage people to actually have this board, Save Hands. As you can see, what's the takeover of the campaign? These are between the 5th of May and the 8th of May. We got more than 5,000 today, more than 8,000 photos and pictures of people promoting safe hands in hospitals all over the world. Here is Malou. She's 94 years old. She's a grandma, and so on, and she's asking, I deserve clean care, safe hands. And here is Malou during her hospital stay together with actually the family that was here, family promoting safe hands in hospital. This is absolutely key. And here is Marie, who is actually promoting safe hands at home care for grandma and grandpa. Now, you have seen this movie. It's from dancing to rubbing. So from rubbing to dancing, sorry. That's a movie that we started in 2009 for the World Hand Hygiene Day. This movie has been seen more than 250,000 times. But not only that, it has promoted other movies, like a viral spread of social network works. And if you want to access the movie, you can go on Google and write From Rubbing to Dancing. everything, it always comes first. And you will see that thousands of movies have been made according to this movie, and this is the movie that you have seen earlier, and I'm asking the team in the back to start the end of this movie in order for you to understand the viral spread. Thank you for starting the video.
Hands and I cannot lie, no patient will deny that when a nurse walks in with gritty dirty hands and thinks that it's okay, you freak out. Wanna leave and run, dirty hands you just can't trust. The dirt's so clear it's scary, so bad you can't stop staring. Oh doctor, I hope you're cleaner.
Oppan Gangnam Style. Gangnam Style.
So the movement you see here is a movement we introduced in 2006.
Sexy lady. Oppan Gangnam Style. Hey, sexy lady. Oppan Gangnam Style.
Thank you very much.